That looks really good.
That's great. Well, thanks very much, Professor Kwan, for assisting us with this webinar today.
My pleasure.
Thank you very much. We have some questions about macular disease, treatments, and so on. Some of them are from participants in this webinar today. One of the first questions that people often ask us is, why can't stronger spectacles help people with macular disease?
Well, in simple layman terms, is that the eye is like a good old-fashioned camera. You have the lens at the front, you have the camera film at the back. The center of the camera film is the macula. So when people have macular degeneration, basically the camera film is spoiled. So it doesn't matter how strong a lens you put in front of the camera, if the camera film is spoiled, you cannot take good pictures, and that is the reason.
I see. Okay, and then, you know, people often get liver transplants and kidney transplants. Why can't we get eye transplants?
Well, eye, if you think about it, is actually an extension of the brain. So the eye, if it is connected to the brain, the wiring and the cells are very delicate. So it is not easy to transplant the eye because we cannot exactly wire the eye directly to the brain logically so that the signal can get back to the brain. So it is still impossible for a whole eye transplant at least.
One of the treatments that is available for people with macular disease is anti-VEGF injections. Could you just explain a little bit about who can benefit from that?
Anti-VEGF injection has been around for over 10 years now, and it has really transformed the care of patients with specifically wet macular degeneration. Again, in simple terms, there are dry and wet. I'm not talking about dry or wet eyes. I'm talking about the inside of the eye at the macula or the retina. In the dry macular degeneration, the cells basically died and cannot function normally. In wet macular degeneration, basically there is a bleeding point at the back of the eye. And this anti-VEGF therapy basically is injected into the eye and shrink these blood vessels so that it stop it from leaking. It is the leakage of this blood into the back of the eye that spoils the retina. Again, in simple terms, is that the blood is like red wine. If you spoil the carpet with spilling red wine, you want to mop up the red wine as soon as possible before the stains stay. So if you have a wet macular degeneration, you have this injection, it will stop further leakage of the blood or wine, so to speak, so that the carpet would not be spoiled.
And what proportion of people have the wet form as opposed to the dry form?
Well, both are very common. The problem is that the wet form is the one that has treatment nowadays. So most people have the dry form to start with, and then some of them actually turn to the wet form. The important thing for people to realize is that it is not one or the other. It is actually a spectrum of disease. They can start off with the dry macular degeneration, and it will eventually, in some people, turn to the wet form.
Is that why it's so important to check your vision? You may have the dry form, but it may mutate into the wet form?
Yes, so that's why we always ask people to look up for any new symptoms, specifically increase in distortion, increase in the blind spot in the center vision. These are the things that they need to look out for, because it usually shows as the onset of wet macular degeneration.
And I think that it's around about 15% of people that will have the wet form as a proportion of
roughly that.
Yeah. Okay. I'm talking about the population of people with macular disease. Yes. Some people have been told they have dry macular disease, and there's not much that clinically could be done for that treatment at that stage. Why should they get regular checkups, and why should they go to their ophthalmologist regularly?
Firstly, is because, as we mentioned just now, some of the dry macular degeneration do turn into the wet macula. So if they can go to the optometrist for regular check, hopefully nowadays most of the optometrists would have these OCT scan that can help to pick up any new changes that was not there before. That is the first reason. The second reason is that there are a lot of new research coming through in macular degeneration. So there are quite a few clinical trials around the country that deals with dry macular degeneration. And so that hopefully, if any of them or the patient are eligible for these trials, they can at least go into the trial and see whether the treatment can be of any benefit.
Yes, I wanted to ask about trials and treatments and so on. Before I come to that, one of our people at the webinar has asked a question ahead of time, which is there a difference between macular dystrophy and macular degeneration?
Yeah, certainly there is definitely a difference. Macular dystrophy is thought to be a certain inherited type of degeneration of the eye. So they are caused by genetic defects most of the time in the cells, and slowly over time it starts to degenerate. And it may not show up early on in life, it can show up early or late. So those treatment at the moment is still looking at genetic or gene therapy for dystrophy. So it is not quite the same as macular degeneration. Macular degeneration is due to often age-related, sunlight exposure, smoking, or even family history of macular degeneration.
We hear talking about treatments, some wonderful stories of research into stem cell therapy and those sorts of things. Is that related to the dry, and how advanced are those trials?
So stem cell therapy has been around for some time now. There has been some promising result in animal models for stem cell treatment. Unfortunately, in human, it is a bit more difficult. Again, going to the fact that the human eye is a bit more delicate. The cells that we transplant are often progenitor cells. In other words, they have not differentiated into the cells that we want into the back of the eye. So even when we transplant these cells may not turn into eye cells that can be of any use. That is why it hasn't been too successful so far.
So we don't have any human trials yet with stem cells?
There has been human trials all around, but not specifically on Australia.
I see. So it may be a few years off before we have
That's right.
a proper treatment.
Correct.
Yeah. Okay. Good. Yeah, that was a question that was asked about the time frame for treatments. Somebody else asked, what about the bionic eye? Is that a possibility as well?
Certainly, bionic eye is a possibility, and it has already been investigated around the world, specifically America, Germany, and Japan. And in fact, Australia, in Melbourne and in Sydney, there are two separate teams looking at bionic eye transplant. Again, the problem is that the retinal chips that is transplanted is still very rudimentary. In other words, the resolution is not quite the same as a normal eye. The resolution is the one that determines how well you can see the details. So there is no details in those bionic eyes at the moment.
Right. Well, I'd like to thank you very much, Professor Kwan. That was very, very interesting, and I hope it's of value to the participants in today's webinar.